In the context of survivalism, the ability to handle medical emergencies is an essential skill. In crisis situations, whether a natural disaster, societal collapse, or an adventure in remote areas, access to hospitals, doctors, or emergency services may be limited or non-existent. Thus, mastering basic first aid is not just a matter of preparation but a necessity to ensure the survival of oneself and others. This video explores the fundamentals of first aid tailored to emergencies within the scope of survivalism, offering practical guidance, accessible techniques, and improvisation strategies for adverse scenarios. 1. The importance of first aid in survivalism. At its core, survivalism is about anticipating and overcoming unexpected challenges. While many focus on stockpiling food, water, or gear, health is often overlooked until an emergency strikes. A severe injury, an infection, or heat stroke can turn a manageable situation into a tragedy without the knowledge to act swiftly. First aid serves as the initial line of defense against health deterioration in a crisis. It allows for stabilizing a victim until professional help arrives, or, in extreme scenarios, entirely replaces that help. In survivalism, the goal extends beyond treating cuts or fractures. It's about maintaining a group's functionality, preserving life in hostile conditions, and adapting to the absence of conventional medical resources. Therefore, learning these skills is as critical as carrying a knife or knowing how to start a fire. 2. Basic principles of first aid. Before delving into specific techniques, it's vital to understand the principles guiding first aid in emergencies. Scene assessment. The first step is ensuring safety. In a survival scenario, this might mean checking for hazards like fire, wild animals, or unstable structures before acting. Never become a second victim. Prioritization. Triage in a group. Identify who needs immediate attention. Injuries with heavy bleeding or breathing difficulties take precedence over sprains or minor cuts. Life preservation. Focus on maintaining vital functions, breathing, circulation, and bleeding control, before addressing secondary issues. Improvisation. A survival kit won't always have sterilized bandages or ready-made splints. Knowing how to use available materials, like clean cloths or branches, is key. These principles form the foundation for any intervention, whether in a remote campsite or after an earthquake. 3. Essential techniques for emergencies. Below, we detail some of the most relevant first aid techniques for survivalists, with practical instructions and adaptations for resource-scarce situations. Bleeding control. Severe bleeding is one of the leading preventable causes of death in emergencies. A survivalist must know how to act quickly. Direct pressure. Use a clean cloth, or your hand, if necessary, to press on the wound and stop the bleeding. Maintain pressure for at least 10 to 15 minutes without interruption. Elevation. If possible, raise the injured limb above heart level to reduce blood flow, but only if there's no suspected fracture. Tourniquet. In extreme cases, such as amputations or arterial bleeding, spurts of bright red blood, a tourniquet can be a lifesaver. Use a wide band, like a belt or strip of fabric, and tighten it above the wound, but never directly over a joint. Note the application time and don't loosen it until help arrives, as this could trigger shock. In survival contexts, improvised materials like ropes or clothing strips can substitute for industrial tourniquets if applied correctly. Cardiopulmonary resuscitation, CPR. Cardiac arrests can result from drowning, electrocution, or extreme exhaustion, common risks in crisis scenarios. CPR is a critical technique. Check responsiveness. Call out to the person and gently shake them. If there's no response, check for breathing. Chest compressions. Place your hands on the center of the chest, in line with the nipples, and press hard and fast, about 100 to 120 compressions per minute, roughly the beat of Stayin' Alive by the Bee Gees. Allow the chest to fully expand between compressions. Artificial respiration. If trained, combine 30 compressions with 2 mouth-to-mouth breaths, covering the victim's nose. If untrained, focus solely on compressions. In remote areas, CPR may need to be sustained longer than usual, until the victim recovers or the rescuer is exhausted. Treatment of fractures and dislocations. Bone injuries are common in falls or structural collapses. Immobilizing the limb is essential. Immobilization: use improvised splints, such as branches or boards, padded with cloth or moss. Secure above and below the fracture with ropes or strips. Dislocation reduction: if a shoulder or finger is dislocated and the rescuer is experienced, a careful reduction may be attempted. Otherwise, immobilize and seek help. The priority is to prevent movement that worsens the injury, especially in environments where immediate transport isn't feasible. Burns. Burns can occur from fire, sun exposure, or chemicals in survival scenarios. Cooling: rinse the area with clean, cool, not icy, water for 10 to 20 minutes. Avoid direct ice, which can damage tissue. Covering: protect with a clean, dry cloth, avoiding ointments or homemade remedies that might cause infection. Hydration: severe burns lead to fluid loss. If the victim is conscious, offer water in small sips. Without access to specialized ointments, the focus is on preventing infection and maintaining hydration. Shock treatment. Shock, hypovolemic or traumatic, can accompany severe injuries or dehydration. Positioning: lay the victim down with legs elevated, about 30 centimeters, unless a spinal injury is suspected. Warming: cover with blankets or clothing to maintain body temperature. Monitoring: watch for signs like cold skin, rapid pulse, or mental confusion. Shock requires ongoing attention, as it can escalate quickly in harsh environments. 4. Assembling a first aid kit for survivalism. A well-prepared medical kit is a cornerstone of survivalism. It should be lightweight, portable, and suited for prolonged emergencies. Essential items include basics: bandages, sterile gauze, adhesive tape, scissors, tweezers, and disposable gloves. Bleeding control: tourniquet, hemostatic dressings, if available, and elastic bandages. Medication: painkillers, paracetamol or ibuprofen, antihistamines, for allergies, and oral rehydration salts. Improvisation: duct tape, needle and thread, for simple sutures, and a compact first aid manual. Specifics: sunscreen, insect repellent, and personal medications, like insulin. In survival scenarios, the kit must remain functional even after months of storage, with items resistant to moisture and heat. 5. Improvisation in resource-scarce scenarios. A survivalist's true edge lies in improvising when resources are limited. Practical examples: bandages: clean fabric from shirts or scarves can replace gauze. Clean water for wounds: if saline isn't available, boiled and cooled water can be used to clean injuries. Splints, branches, sticks, or even backpack parts can immobilize fractures. Natural pain relief: in extreme cases, willow bark, rich in salicin, similar to aspirin, can be chewed for pain relief. Improvisation demands creativity and basic hygiene knowledge to prevent infections, a heightened risk in unsanitary settings. 6. Prevention and training. In survivalism, prevention is as crucial as treatment. Measures like wearing proper boots, staying hydrated, and avoiding prolonged sun exposure reduce emergency risks. Training is also indispensable. Courses: enroll in certified first aid courses, such as those offered by the Red Cross. Simulations: practice techniques like CPR or tourniquet application at home with friends or family. Reading: study field medicine manuals or survival guides with medical sections. Theoretical knowledge paired with regular practice boosts confidence and effectiveness in real situations. 7. Psychological considerations. Medical emergencies don't just affect the body, the psychological impact is equally critical. A survivalist must be ready to handle stress, fear, or panic, in themselves and others. Calmness: stay composed to make rational decisions. Support: talk to the victim, offering encouragement to ease anxiety. Self-care: after an intervention, take time to emotionally process the event. Mental resilience is an underrated but vital component of first aid in prolonged crises. Conclusion: in the context of survivalism, first aid basics for emergencies go beyond merely applying a bandage or splinting a broken bone. They embody a mindset of self-sufficiency, adaptability, and responsibility for life, both one's own and others. In a world where help might be days or weeks away, or never arrive, these skills distinguish survival from collapse. Mastering techniques like bleeding control, CPR, and fracture treatment, combined with the ability to improvise with limited resources, equips a survivalist to handle everything from minor accidents to catastrophic disasters. A well-stocked kit, continuous training, and a focus on prevention complete this approach. Above all, first aid in survivalism serves as a reminder that, even in the harshest conditions, life can be preserved with knowledge, calm, and determination. And remember, always be prepared.